mother who doesn't have enough knowledge on how to take care of her 3-month-old baby. This causes her and her partner to be worried after noticing that their baby is having a high fever, dry cough, and rashes between her legs and neck. Due to anxiety, she immediately went to the healthcare center to seek for help.
Hello? Anyone here?
Hello, ma'am.
My baby is sick and she's just 3 months old. She's been having high fever these past few days.
Okay, ma'am. The health center is still open. This is an emergency. You need to come over now. Okay, ma'am.
The phone call between the nurse and the mother is the beginning of the therapeutic relationship phases. There are 4 phases of therapeutic relationship, and the first one is pre-interaction. It begins before the nurse's first contact with the patient.
Good day, ma'am and sir. I am Saiki and I'm one of the nurses here. How can I help you? What brought you here in the health center today?
Our baby is sick, nurse.
Are there any medications that you gave to your baby?
Nothing, nurse. I'm looking for a job at the moment to take my daughter to the hospital.
Nurse, will my baby be okay?
Yes, ma'am. Everything will be fine. I'll just call the doctor to attend your concern.
May I also take your vital signs, ma'am? I'm going to check first your pulse rate. Arms, please. Your heart rate and blood pressure is high, ma'am. I suggest you come down a bit. Don't worry, your baby will be alright. And I will be here with you until your partner and your baby gets back. So please, ma'am, I need you to come down a bit.
How am I supposed to calm down, nurse? My baby is sick and she's just 3 months old. I don't know what to do if something will happen to her. I know it's my fault for giving birth at an early age, but my child did nothing wrong. Why is she the one in pain? I really can't forgive myself.
That scene shows the second phase of the therapeutic relationship, which is the introductory or orientation phase. During that phase, the nurse sets the stage for one-to-one relationship by becoming acquainted with the patient. The nurse explores the patient's perception, thoughts, and feelings.
Tell me more about that, ma'am. What happened before you know that your baby is sick?
I was just breastfeeding her and we were about to sleep, but she cries and I felt that she is hot. That's why I called for help.
I see that you are really worried about your baby.
Of course, because even people see her as a mistake. She's a blessing to me.
She is indeed a blessing to you.
Yes, it's my mistake. But after I first heard her cry and first saw her, she gave more meaning to my life.
Can you tell me how is it for you? What people think about you as a teenage mother?
It's very difficult for me, but I'm enduring it for my baby. I will just focus on becoming a good mother.
Don't worry, ma'am. I will help you on how to take care of your baby.
I would really appreciate that, nurse.
I will give you notes on what you're supposed to do and what you're not supposed to do to the baby. Though there are times that they will make you worry, but you need to stay calm, ma'am, because only then will you make appropriate actions and decisions for the baby. And I will also teach you how to cope with anxiety, because it seems that you easily get nervous.
I thought so, nurse. Thank you very much.
In this scenario, we have seen the working phase of therapeutic relationship. The nurse helped the patient to master anxieties, increase independence and self-responsibility, and to develop constructive coping mechanism. As a result, the patient began to relax and trust the process.
Date admitted April 25, 2021 at 2:30 p.m. The baby cannot sleep, has a fever, dry cough, and presence of severe rashes between her legs and neck area. Body temperature 38 degrees Celsius, respiratory rate 30, heart rate 110, weight length 19 inches, head size 35 cm, and chest size 1 cm.
What does that mean, nurse?
It's nothing serious, ma'am. She's only having a light fever made due to weather, and fever is common to babies. So the doctor prescribed your daughter with acetaminophen 2 times a day for 1 week. So it is preferable taken every morning and night. And also petroleum jelly, because I observed your daughter has a lot of rashes between her legs and neck area. So this will serve as a treatment for diaper rashes to keep it clean and dry as possible.
Thank you very much, nurse.
You were really nervous earlier, ma'am. How do you feel right now?
I am relieved, and it is also because of your comfort and help to me. I understood your teachings, nurse. I promise to follow them.
I would also suggest to let your infant wear lightweight clothing like sheets or light blanket to keep her comfortable and cool. And dehydration can also cause fever, so it is important to offer or give your daughter fluid.
I will keep that in mind, nurse.
Come back again 2 days from now, ma'am, so we can recheck the baby. And if you have any concerns or anything, our health center is open and we are here to help. Thank you, ma'am. Thank you, sir. Take care on your way home.
Thank you very much, nurse.
The last phase of therapeutic relationship is the termination phase. During the termination phase, learning is maximized for both the patient and the nurse. It is a time to exchange feelings, memories, and to evaluate the patient's progress and goal attainment.
The therapeutic interaction between nurse and the client will be helpful to develop mutual understanding between two individuals. Interaction is a learning experience for both client and for the nurse, and also a corrective emotional experience to the client to modify his behavior. In this video, we have shown the elements of professional communication. This includes courtesy, use of names, privacy and confidentiality, trustworthiness, and autonomy and responsibility. The therapeutic communication techniques being applied are using open-ended questions, offering self-acknowledging, restating or paraphrasing, providing general leads, giving information, and summarizing, and learning.